Hi my friends, I'm back again, and I'm not quite as enthusiastic this time in continuing this cancer surgery saga because they came back with the biopsy report stating that the tissue that they were looking at that they had just removed had cancer still remaining all around the edges, and so the doctor just came in and took another big piece of the tissue out. It's very deep and round. Now I guess it's probably about the size of a quarter, and I took some pictures of the wound just before they put the bandage on, and so they'll take that new tissue samples into the laboratory and they will analyze those and look at the edges of the sample to see if the cancer is not on that piece. This was a squamous cell level 2 with an undefined border when they did the original biopsy a few weeks ago, and what that means, it's a very serious cancer, and when it's an undefined border, the sample that they took, they couldn't determine how far it had spread, so they don't have much of an option but to go in surgically and start taking out that tissue. There are times when, if they can see it's very superficial and the biopsy revealed, because the biopsy was large enough, they can determine that the cancer had not spread other than that small area, and they can do sometimes they can do some just topical treatments, including a blue light treatment where they just go in and they really kind of burn the skin, if you will, and take off all that layer, and then it seems to, with the immune system, heals. The other thing that it's really important for those of you that are fighting with compromised immune issues, that, like for me, I've been battling AIDS for 16 years, and there's some of you that are battling AIDS, I know, that watch the videos that I put out, and it could be another immune situation. It may not be that, but it could be any number of things, that it makes it even more difficult to deal with the cancer issues. Our immune systems don't respond as effectively sometimes, and sometimes they respond better because the immune system is hyperactivated, so it can aggressively go after skin cancer more than it might just a person who doesn't deal with the other immune issues. But for most people battling AIDS, like I have been for 16 years, these kinds of things can turn bad really quickly, and so they have to be a little more aggressive about the treatment protocol. So I go through a lot of these difficulties on a continual basis. It's always difficult. I always hope for the best because I do trust in God to watch over me, and I know that when I leave this earth, I go before the Lord and I'll live in heaven. So I'm not so concerned about how I suffer throughout the remainder of my life as much as I am doing what God wants me to do with the remainder of my life while I'm here, to try to help people, steer people away from making bad decisions. And sometimes people fight me on that because they want to have the liberty to do all the destructive things, but they don't really understand when you're in the suffering consequence of those behaviors, it's no longer a fun thing to think about, oh, I'm going to do whatever I want and nobody's going to tell me what to do. And so if you really care about somebody, then you're going to try to do everything possible to persuade them not to do it. You've got to tell the story of the consequences of those bad decisions. You can't cover them up and make excuses for them, because you're only hurting yourself, and you're also encouraging other people to go down the dark road that you've gone down. And I just can't live with the conscience where I'm not telling people the bad things that happen when you do certain lifestyle choices. And so I'll let you know as soon as I get the next biopsy report back, and I'll continue this segment. All right, until later.